Hi, I'm Lori Schulman. I am the marketing chair of HIMSS Northern California. And today I'm happy to be here with Altus Lifesciences. They are a women's health organization that focuses on women throughout their entire life cycle. I also am delighted to have with us Dr. Krithika. She is a physician and has a master's in public health. She is currently the COO of MedPixels. They're a medical service organization based in San Jose, California. Welcome, Dr. Krithika.
Hi, Lori. Nice to
Nice to see you
happy to be
today.
here.
Thank you for being with us today. I'm going to ask you some questions related to women and health, particularly about women who have gone through pregnancy. Um, how does a woman know she's going through postpartum depression? What are the symptoms? Because I hear this is something that comes up a lot.
Yes, that's a great question. So you're right, it does come up a lot, and we have noticed that it's coming up a lot more during the pandemic because people are not having the support system that they used to. So postpartum depression is something that occurs after a woman has her baby. So the feelings of postpartum depression are very intense and they last a really long time. So some of the symptoms to look out for are if you feel like you're crying more often than usual, or you're feeling angry and irritable either towards yourself, your spouse, or your baby, or you feel like you're withdrawing from your loved ones and you don't really want to engage with anyone else, or you worry that you're either going to hurt your baby either intentionally or unintentionally, or you constantly worry about your capabilities as a mom. And if you feel like you cannot connect with your baby. So these are some of the symptoms that women should definitely keep an eye out for because they could be symptoms of postpartum depression.
Okay, very good to know. And given the COVID crisis, how are women dealing with, or coping with postpartum depression, particularly when social distancing is expected?
Yes, and that's important because you have to maintain social distance, but you can still get help. So one thing that women should do is either you can contact your OBGYN or you can contact your primary care physician, and they will have screening tools that they will use to determine if you do have postpartum depression and how severe it is. And then based on that, they will suggest a whole treatment plan for you. But what there are some things definitely women can do for themselves on their own. So one thing is to digitally connect either through video call or just regular phone calls with your family and friends. It's really important to stay connected. Another thing that's an option is make healthy lifestyle choices. Eat healthy. Try to walk around the block maybe once a day. Just try to sleep and try to get some rest. It's really important because these things affect mood a lot. One more thing to do is to set realistic expectations. You are a new mom, and there's a lot of expectations that we set on ourselves that we have to be super moms to our babies, but you have to be realistic. You have to know what you can achieve in a day and what you can do for your baby in a day. So set up those expectations. You can also divvy up the responsibilities. You can ask the dad to take care of one feeding or one bath, and they can really, that way your partner is also very involved with the childcare. And make time for yourself. Take time to read a book, listen to music, just relax, and also take time to spend with your partner, minus the baby, right? Because you guys were there before the baby came along. So it's really important to keep that relationship going and to have that private time that when perhaps when the baby is sleeping.
Right, those are all great ideas. I think they're very healthy ideas for everybody to follow. Question about, we talk about partners. How do dads and partners also experience postpartum depression? Can you tell us a little bit more about that?
Yes, yeah, they definitely do. So it's not very known, but there is something called as paternal postpartum depression, and 1 in 4 men will experience this, and they can experience it anywhere between birth of their baby to up to 1 year after the birth. So, and unfortunately, there's really not much awareness about this. And there are some symptoms that men will experience. So a lot of symptoms overlap with what the women will experience. But some symptoms that men should look out for is if they are feeling terribly unmotivated, or you feel like you're gravitating towards alcohol or substance abuse, or you want to engage in risky behavior or violent or aggressive behavior, or if you feel very angry, very irritable for no apparent reason, and or if you constantly have headaches and stomach aches. So some of these symptoms, if you do experience constantly, you should definitely contact your primary care provider so that they can assess you for paternal postpartum depression.
Okay, very good. That's kind of a, just not knowing about this, that men are also impacted, is really eye-opening to hear. This question just came in through the chat. What can women do to overcome postpartum depression? Are there any treatments?
Yes, there's a lot of different kinds of treatments available. So one thing to do is your doctor may suggest therapy. So please try to attend therapy sessions. Most of them are over Zoom or some other video calls. So you can definitely do it from the comfort of your home. And it's very important to do therapy because while you may have a supportive partner or other support system, there are many things that you'll only be able to tell a therapist without worrying about being judged or anything like that. So I think it's really important to go for therapy sessions. They will also be able to give you tools and skills that you can work with, and you can always go back to these when those feelings crop up again, so that you don't feel overwhelmed. So another thing that your doctor may recommend is medications. So most commonly the medications used are antidepressants. So your doctor will assess, and if you're breastfeeding, they may want to wait, or they may try to give you one antidepressant medication over another, so that your doctor will be the best judge of that. And another type of therapy available, and this is especially for cases that are sort of resistant to standard therapy or medication, and you feel like your symptoms are not really responding to that, your doctor may even suggest electroconvulsive therapy. So that is another option, but that is way down the line, and that is something that your doctor will determine.
Okay. So it's good to know there's different treatments available, because everybody's different and not everything will work for each person. So thank you for that. Anything else you'd like to share about this issue that we're discussing?
Yes, I just want to put out there that, having depression can affect your baby. And it's a real diagnosis. It's not something that will just go away on its own. So, and getting treatment for it is very, very important for yourself and for your baby and for the health of your family. So, and taking medicines for depression doesn't mean that you're a failure or you're not a good mom. And I just want to put out there that getting help is a sign of strength, not weakness. So if you feel like you have these symptoms, please reach out for help, because there's a lot of help available.
Thank you, doctor. That's very valuable information. Thank you for sharing that and enlightening us on postpartum depression during COVID-19. All right.
Thank you.
Thanks.
It was
Thank
great being
you.
here.
Thank you for being here.